Tim, I'm going to throw it over to you. Where does Equinix fit into this healthcare ecosystem? I'm sure very firmly and very securely. Give us a top line.
Yeah, absolutely. Thank you, Luke. And I'll be honest, this is a hard one to come behind after everyone's already spoken. But I'll do my best to, I think, provide a little bit of a summary. But yes,
Sure.
Equinix is a very interesting company. A lot of us associate us with data centers, and while we do manage, lots of data centers, and I know VA and HSS are customers of ours, but honestly, we're more of an interconnection company, and that's really the history of us. We've brought together and helped build and support, if not steward, ecosystems. And one of the ones that we've been focused on in the last several years is the healthcare ecosystem. And we realized very quickly that having a front row seat to this digital transformation that's been going on now for probably 10 years, is that these organizations are trying to adopt these newer technologies, AI, of course, maybe even quantum computing shortly in the future, but their underlying network is not very sound. It was based on an architecture that was designed 20, 25 years ago, a very common hub and spoke model where all the data was brought back to the data center, right? And at the time, that made the perfect sense of the world, and it was the right architecture. But the world has changed in the last 25 years. The data is not all in the data center anymore. It's elsewhere, and it has to get to clinicians, and it has to get to a patient, and it has to get from the patient back to an EHR system. So when I think about like what Jennifer was talking about with regard to IHS and trying to upgrade this RPMS system and basically turn it, move it into the 21st century, my immediately thought of, well, geez, those tribes, 574, if I heard correctly, across 37 states, is the network sound? Is that most important, right? If the network architecture is sound to be able to support that, and you've got what we call layer one in place, and Gary can come behind me later and maybe chat about this a little bit, but if your layer one's the physical connections in place, then everything is good, right? But then that also begets the question, well, where does the workload in comparison to where the data needs to be? And so very often we get in situations with, and again, I also support the private sector. So I talk to very large hospital systems regionally and even internationally in some cases. But really, where is the EHR data? Because if the EHR data is sitting in California, but most of your patients are in, say, the East Coast, that doesn't make much sense. We should get the EHR closer to the patients. And oh, by the way, if you're a large health system like VA and you have to support veterans all over the U.S., CONUS and maybe even OCONUS for all I know, then ultimately you might need copies of that data. You want to have a copy East Coast, West Coast, North, South, CONUS, OCONUS, right? And replicated and eventually consistent so that everybody can access the same data. And so that's kind of what we talk to a lot of our health systems and these agencies about, is about better ways to modernize the network infrastructure first, take a look at where Equinix facilities are, and ultimately we're on top of the network fiber. So if you look at network maps, you'll find Equinix, and then you very simply say, well, is the foundation solid, and is the foundation in place first? Because if that's there, then what Jennifer wants to do with IHS and be able to support the 2.6 million Native American Indians and be able to promote their health and their well-being, then we've got to have all this infrastructure kind of ready, the foundation, if you will, in place first. Absolutely. And then that leads to lots of other advantages, which we'll get to later.
Sure.